everybody, welcome back to the Medical Projects YouTube channel. If you are new around here, my name is Olivia and I'm a second year medical student at King's College London, and here on the Medical Projects YouTube channel we release videos every single week detailing our best bits of advice to ensure that you get your dream spot at medical school. So if you like the sound of that, do make sure you subscribe to our channel, turn the notification bell on so that you can be notified every time we post, and make sure you give this video a big thumbs up because that always helps us out. So today's video is going to be a really fun one. It's actually very highly requested because a lot of you guys have said, can we show you a kind of mock MMI style interview or help you answer some really common interview questions? And as I always say, we always listen to you guys and we take your video suggestions on board, and so that is what we are going to be doing today. My flatmate Lizzie very kindly agreed to let me interview her over Zoom, so I'm going to be asking her 5 very common medicine interview questions so that you can get a bit of a feel for how you should answer. She's a very strong candidate. She's also a graduate from Cambridge University, so big up Lizzie, everyone. Let's give her a lot of love in the comments down below because she very kindly offered to help me with this video. I've tried to pick questions which cover certain themes within a medicine interview, so we've got some ethics in there, we've got some exploring your general motivation for studying medicine in there. We decided to do this over Zoom because we wanted to simulate what a MMI might look like this year, and of course a lot of you guys will be having these online due to the pandemic, and so I hope you guys will find this mock interview very useful. Do let us know what you think of it in the comments down below. So without further ado, here is a taste of some of the questions that you might come across in your own medicine interviews. Elizabeth, your first question today is, why medicine?
I think for me, I'm really interested in helping people and having like a career where I can actively see like the difference that I make in the world. So when I was looking into medicine and other healthcare roles, I looked into other roles that support doctors like nursing and paramedics. But I think medicine kind of stood out for me in like being in the ability to diagnose and have that kind of it's a bit like a detective story where you can work out exactly what is wrong with the patient and come to the conclusion of how best to treat them. And I think I really value the work that people like paramedics do in helping in really critical situations. But I think the breadth of medicine was really something that kind of drew me towards that in particular.
Yeah, great. And as you mentioned, there are many different healthcare staff members, so why not nursing? Because they have a similar kind of patient-facing role. So what made you decide that actually I want to be a doctor instead?
So I looked into nursing, and I think there's a lot of capacity now actually in nursing to learn a lot more about, for example, diagnosing, because there's lots of nurses in GP practices that also help with taking consultations on their own and supporting doctors in that way. But I think although the work is incredibly valuable that nurses do, I think for me I wanted something where I had that constant progression and was able to keep on learning, keep on looking into different spheres of medicine and sort of have, again, like I said, that kind of width of knowledge.
Mm-hmm. Yeah, absolutely. And when it comes to being a doctor, are there any aspects of medicine or becoming a doctor that you're worried about or you think might be downsides to the job?
Oh yeah, I think it's an incredibly taxing job, both in terms of the sort of hours that you do and in terms of it being sort of emotionally draining, as well as like all of the disadvantages that come with any sort of like person facing role. It's sometimes incredibly difficult to deal with people that are emotionally distressed, and I think seeing people who are very unwell will be really quite difficult for me, but I'm hopeful that that's something that I will be able to talk to my colleagues about and be able to sort of work through and continue to have sort of a sustainable career in that sense.
Thank you for that. So your second question is, what in your opinion is your greatest weakness?
So I think for me, probably my greatest weakness is that I sometimes procrastinate quite a bit before starting a task. And I realise that that is something that sort of holds me back in being able to sort of fulfil my goals, as well as something that's sort of isn't very helpful for medicine, given that there's lots of situations where things are time critical. So the way that I've started to try and think about that, and having done some reading on sort of procrastination, is that it's a lot easier to sort of write down the feelings behind that and then come to sort of a conclusion that getting a task done and making sure it's done rather than like perfect is the best way to sort of go about it. So what I'm trying to do to work on that is to ensure that I write down the critical tasks that I need to get done and sort of remind myself that like done is good enough and is better than not done at all. Yeah.
Absolutely. And so you mentioned that you like to write down the feelings behind that. So is that something you do often? And why do you think that reflection is an important skill as a doctor?
That's an interesting question. So I think that is important for me because it helps me see why I am procrastinating or why I'm not doing the job that I'm trying to get done. And I think that by looking at sort of the reasons behind that allows me to sort of combat them rather than be distracted by the task itself. Yeah. And I think reflection and sort of improvement is really critical in medicine because it allows clinicians to constantly be thinking about ways in which they can continue to develop their skills, their communication, and given how fast-paced or how stressful a lot of medicine is, you might not get that time while you're in a consultation. It might be something that you have to think about afterwards, and kind of consider how it might work if there was a different patient in the room, or how you might have to sort of change the way that you communicated with somebody if, for example, English wasn't their first language.
Yeah, absolutely. Very valid points. So, Elizabeth, for your third question, this is going to be a bit of an ethical dilemma. As I'm sure you're aware, we face many of these in medicine every single day. And this one today concerns two patients that are both in need of a lung transplant. The first is a 12-year-old girl who has cystic fibrosis, which is a chronic condition that affects your lungs. And the second patient concerns a 62-year-old chronic smoker who has a wife and 2 children, and he has very damaged lungs from smoking. So who, in your opinion, should get the organ, because there is only one organ available?
Well, obviously that's a really difficult and horrible situation, but it does sort of go to show that there sort of are decisions being made where resources have to be put one way and not another. So I don't have an immediate answer, but if you don't mind, I'm going to work through what I'm thinking and then hopefully I'll come to a conclusion. So I guess in terms of the ethical principles behind sort of medicine, there's autonomy, which is like the patient's right to choose. So in terms of considering both of the patients, you'd need to make sure that both of them would want a lung transplant and would be like fully able to carry on with the follow-up and come to appointments and have that sort of, I guess, that ability to choose between treatments as well if they're offered different types of treatments. Yeah. I'm afraid I don't know about all of the different types of treatments that they might have, but there may well be that for one of the patients, for example, the older man, there might be treatments available that have quite a lot of evidence-based theory behind them that might be a good alternative for treating his lung condition, and there might not be alternatives for the younger girl. So I guess considering other options as well would be one of the ways that I'd sort of come to a conclusion. I guess as well, it's probably worth saying that I think I would want to discuss this with other people. I think this is something that medicine is about, teamwork and like multidisciplinary teamwork. And I think this is something where having the input of people that, for example, a GP that might know both patients better than I might, would also be a really good way of sort of assessing their current like prognosis, and so and also ensuring that we sort of know about the support that they have to help after that transplant or not. I think it's worth saying as well that that medicine works on sort of non-maleficence and beneficence, so doing the right thing and trying not to do harm. So that would be one of the reasons why as well I would consider what other options the patients have. We want to reduce the harm that occurs to the patient that doesn't get the lung transplant and support their sort of recovery and health in as many ways as we can as well. So it might be things like helping the man to stop smoking, which would still reduce his the symptoms hopefully of his lung condition, and also like giving support in school for the child that has cystic fibrosis. And then in terms of justice, I think it's worth saying that it shouldn't matter like who the patient is. So the fact that for example this man was smoking doesn't mean that he doesn't have shouldn't have equal access and right to the same sort of healthcare, and that his treatment and his health is as important as somebody else's. So I think it's obviously a really difficult decision, and I think there's other factors to consider, sort of like the age of the child. So they might have a lot longer in sort of life expectancy if they have the lung transplant as compared to the older gentleman who might not have as long in his life anyway. And it might be that but then it's, I guess there's other considerations such as he has a wife and child who he might be supporting, and obviously everybody is incredibly important in their social spheres as well. So it's a really hard situation, but I think given the age of the patients, I would probably give it to the child who was suffering with cystic fibrosis, if other considerations couldn't if there were no other treatments available.
Yeah, absolutely. I think, as you mentioned, it's a very difficult scenario, and I don't think there is any right or wrong answer. But as you highlighted, it's so important that we don't discriminate based on, the fact that he is a smoker, and you could argue it's a self-inflicted disease, because that's not how we make decisions in medicine at all, and we treat people with equal fairness no matter what. So really nice answer, thank you. Okay, so moving on to your fourth question, I want to show you an object and you're going to describe to me what that object is and how I use it, because let's pretend I've never seen this object before. What is this, and how would you explain how to use it to me?
So that is it's called a mobile phone, or a phone, and it is essentially a device that allows people to communicate. So that looked like a phone that had a touch screen, so you would switch it on and open it up, and what it allows you to do is, if you have one of these and somebody else who's a long distance away from you has one of these, you'll be able to call each other and speak through it as though you're having a conversation like we are now. It is also something that has developed over time. So used to be something that worked using telephone wires and would have to be plugged into sort of the sockets, but now works on satellite technology. So allows you to communicate over long distances or short ones, as well as sort of being something that you can speak to people through. It's also a device that allows for many other different activities, such as taking photos, listening to music by using headphones which sort of plug into your ears so you can hear through those, and by connecting to the internet. So you might be able to ask a question of your phone, for example, or search for nearby restaurants. So that would involve opening up the internet function, typing in what your request is.
So thank you for explaining to me how to use this object that I showed you. Why do you think I asked you to do that?
So I imagine it's because communication is like a pivotal skill in medicine, and as doctors we would have to communicate with not only other doctors and patients, but of course like members of the multidisciplinary team, so nurses, paramedics, and I guess families, as well as for certain doctors sort of marketing in public health campaigns, and communication is sort of the essence of making sure that you are providing like good care to your patients, because if they don't feel comfortable telling you things and you can't explain things to them, then they don't know what kind of treatment they're on, they might not sort of understand their condition properly or how to manage it, and you might not be able to communicate what they're sort of telling you to other doctors or nurses that might need that to sort of continue or sort of help manage their care as well.
Yeah, absolutely. Okay, so moving on to your final question, what I want to ask you is, why King's? Why have you chosen this medical school? We have so many in London, so why King's?
So I think for me, I was really interested by King's because of like the structure of the course. It's a course that gives opportunity for things like dissection, and I know that you start seeing patients and being sort of like in clinics in second year, which is something that I really wanted, because I know that for me it's really important that I improve sort of my communication skills and get used to being in that working environment quite early on. I think also I really wanted to study in London because it's such a vibrant and exciting city, but like you said, there's so many medical schools in London, so I think for me King's was the one that kind of like offered the course that I want, and I think has lots of opportunity for things like extracurricular activities, and lots of sort of places nearby as well that I'd like to visit. I was also quite interested by the way that you teach anatomy, which I know is done through dissection, which I think would be really good for me because I kind of learn in a very practical way. And it has a really good research reputation as well. I know that King's bring out lots of papers and they sort of have a lot of research going on. And I think as doctors, well, and for me, I would like to get involved in that. And so being somewhere where there's those sorts of opportunities to learn through that kind of active involvement is something that I really like.
So that was the mock MMI. I really hope you guys found this useful and you thought about some of the ways that Lizzie approached the questions. If you like this video and would like some more similar videos to this, do let us know in the comments down below. If you haven't already, do once again make sure you have subscribed to our YouTube channel, give this video a like, and let us know any other videos you would like to see in 2021 because we have a lot of content planned for you guys. I'd also like to point out that here on Medical Projects we do offer a virtual mock MMI, so if that's something you're interested in and if you'd like to get an edge for your real interview, do definitely make sure to check that out. Thank you guys so much for watching. I hope you enjoyed and I'll see you in next week's video. Bye!